Hello, my friends. I'm really excited for this podcast and hopefully videocast too, because there's going to be some really cool techniques that we're going to be sharing today. I have a guest with me that I'm really so happy to introduce to you. She's going to be talking about pranayama, so breathing techniques to help with pain, tension, and we're also going to bring in just, even if you don't experience pain and tension in your body, anxiety, just basically relief from all of those things, which I'm sure all of us have experienced at some point, and many of us are experiencing right now during this kind of challenging time in history. So welcome, Dr. Amruta Inamdar, to my show. You want to say hi to
Thank
everyone?
you.
Yes.
Hello. And I've been following Bree for a long time. I'm one of probably her biggest fans. So this is really like a dream come true for me. Thank you so much, Bree, for having me on this show tonight.
Oh, what a blessing. I'm so glad to have you on. So let me just give you a brief little background, and then we're going to dive into the subject. This is going to be a really actionable kind of like take home tip show. And so please, definitely tune in for the long haul. This is going to be a really good one. So Dr. Amruta is a physical therapist who specializes in pelvic health rehabilitation. She believes in combining her knowledge of Eastern healing philosophies with evidence-based Western medicine to provide a holistic approach to recovery after birth. Dr. Inamdar has trained with industry leaders in the field of pelvic pain rehabilitation, both in the United States and in India. She brings a wealth of knowledge from 13 years of clinical experience and has successfully treated over 5,000 patients, you guys. This woman knows her stuff. Yes, I'm really a huge proponent of bringing the worlds of Eastern and Western medicine together. There is so much wisdom from the traditional medicine, and particularly from my perspective, I love, Ayurveda and medicine that I'm sure, you are very familiar with. And the pranayama and the yogic tradition that I was trained in, and I'm still just such a beginner. I mean, thousands and thousands of years of knowledge here. Of course, I'm still a beginner. I'll never even scratch the surface of this vast wealth of knowledge of, yogic philosophy and Ayurvedic medicine and just all of the Eastern philosophies. They're so broad and so varied and so deep. But I want to talk specifically about pranayama today. That's one of your specialties. So what is pranayama? Let's start there.
Yeah, so pranayama, in PT school or even in school here, we are taught about different breathing exercises, right? Pranayama is slightly different in a way. It is the way by which you modulate your prana shakti. Okay, so pranayama in its word itself means it's a combination of two words, prana, that is cosmic energy, and ayama, that means union, okay, or control. Ayama is control. So basically, it's a method by which you control the cosmic energy that comes in and out of your body, and you do that through breath. So that is pranayama. So it goes beyond just simple breathing exercises. It actually is a very powerful technique by which you actually modulate the way your body responds to different stimuli in this world.
Wow, I love that. Do you ever explain this because I love that you just used this languaging that just gives me shivers and chills of excitement. I love talking about energy and, cosmic energy. That's so cool. But I would say in Western, as an American myself, in Western medicine, that's not really languaging that's used. And so do you ever experience resistance to that with your patients? Or I'm just curious to know, how you manage that.
Right. So in the beginning, I used to explain it the way I was taught, right? That was in the Eastern philosophy. But then I started encountering slight resistance in the sense that people were not able to quite get the concept, right? Because our training here in the United States is completely different. It's more evidence-based, right? So that's when I decided that I have to look into literature to be able to blend in what's available through literature and blend in the Eastern thoughts and see if I could plug them together. Because, as much as the Eastern knowledge is important, the evidence-based practice is equally important. So you really need to gel both of them in order to get the best product out, right? So let me explain a little bit in a more westernized school of thought Pranayama does make a lot of sense because it actually modulates your sympathetic, that means your fight and flight response, right? And your parasympathetic, that means your rest and relaxation response, right? So there are very few things or very few modalities in this Western medicine that's available that do this without medication, right? So basically, pranayama is a technique by which you try to control your breath in order for you to be able to modulate or change between sympathetic and parasympathetic balance in your body. And I think that's the key, because a lot of us are always in sympathetic overdrive. That means we are always running behind something. We are goal oriented, or on the other side, we are in pain, So both those factors are highly, highly stimulating for the sympathetic nervous system. And when that sympathetic nervous system overtakes our whole physiology, there are so many bad effects that it could happen, because it's like, your body is designed to be in balance, and if one side starts overtaking the other side kind of gets defeated. And then there are, side effects like unrelenting pain, blood pressure, anxiety, sometimes even depression, because body goes into too much overdrive and then collapses.
Yeah.
So, so that's how we explain pranayama from a Western point of view. But I think it's a very powerful way to modulate your body response to different external stimuli just through your simple breath.
Yeah, I love that. And I love that you said it's the only way we have besides medication. So medication is sort of the Western prescription for anxiety, pain, stress, that kind of thing.
Right.
This breathing is the more, traditional medication in air quotes.
Right.
It's the natural
right.
medication.
It's exactly. It's holistic. It's the way by which you allow nature to kind of calm down your symptoms. Sometimes in my clinical practice, like, if the symptoms are too severe, yes, we do resort to, medication that may be needed to calm down the symptoms a little bit. But if you couple that with pranayama breathing, then you should be able to get off that medication quickly, rather than being in the loop of medication, symptom freeness, then again medication. You don't want to be stuck in that loop. So pranayama definitely helps to get out of that loop, to be able to break that loop and just resort on something more holistic, something more natural that does not have any side effects. Because remember, any medication is going to be followed by physical side effects. Mm-hmm. So that's what I like about this.
Oh, I agree. Absolutely. The no side effects is huge. And actually, I mean, I've personally experienced, I've played with pranayama myself as well, and I've experienced very positive side effects. I mean, including, I actually am a proponent of breathing exercises and calming the nervous system as a weight loss activity, because it really helps manage your stress and your cortisol levels. And I mean, you can speak to this better than I can, but I mean, it calms everything down, and that's actually a really good place to be in, because then you're not stress eating and you're not holding on to those stress hormones that do kind of pack on the pounds through the midsection. So I actually feel lighter. I literally feel when I'm less stressed, like when there's less weight of the world on my shoulders, I feel like my body is physically lighter as well. I can actually look at the scale and feel like the numbers, going down a little bit. Like I've definitely done that myself.
Yes. I mean, definitely cortisol levels, if they are higher, you tend to retain more of water, because the body thinks there's something that's severely stressing your physiology. And that's why body tries to conserve, so even though you're like running and exercising to death, nothing is changing on the scale, because there's a lot of water retention. You are in a cortisol overdrive, and the body really doesn't know what to do. Body thinks it's like a stressor. Something is attacking the body. So till the body doesn't calm down, you will not lose weight.
Yeah.
Like one of my friends, literally, she stopped. She was doing like a very stressful. She was a lawyer. She did something that was extremely stressful every day, right? Her job was extremely stressful. When she quit her job and started doing pranayama and more holistic stuff, her weight, Brianne, dropped by like 30 pounds.
Wow.
Believe that. Like,
I love
so it's amazing.
That is amazing. And that, yeah, great. That supports what I was saying, is that breathing is a weight loss activity. So, well, let's steer it toward our topic, of course, which is about pain, tension. We've talked about the anxiety, but I mean, how could we say that pranayama could actually affect pelvic pain and tension in particular?
Right. So I'm going to base my conversation more on the physiology, like Western school of thought, because I kind of resonate to that more, because that's more reasonable. Like, in the sense you can reason it out and you can really, my iPod came out.
No worries. That's
okay.
Yeah.
So, yeah. Okay. So I have this little pelvic model here. Okay. And I hope everyone can see that. So basically, before I explain what I'm going to say, I want everyone to understand that diaphragm to begin with. So basically, pranayama is a breathing exercise, right? So all of us know that diaphragm is our primary muscle of breathing, right? The diaphragm is connected 360 degrees around the ribs. So it's not like a two-dimensional structure, right? It's literally an umbrella sitting inside our body, and it's attached to all the ribs, right? It's also very important to know that diaphragm, like the action of the diaphragm, is directly mirrored by the pelvic floor, right? So when the diaphragm descends, the pelvic floor descends under normal circumstances, okay? So it's literally an action like this. When the diaphragm lets go, the pelvic floor ascends, and vice versa. So what happens with chronic pelvic pain or with any kind of painful stimuli, our breathing changes, right? So whenever there's a nociceptive stimuli, like suppose, like forget about pelvic pain. If you get stabbed in your foot with some kind of thorn or a stone, right? What happens? This is what happens, right? And then a lot of times when this stimulus is chronic, like, the pain just doesn't go away or the pain doesn't budge, the body is not able to come back into its regular rhythm of breathing, right? So have you seen like a baby who is anxious about getting milk, or who really wants to get her mama to hold her? What happens? The baby is breathing through upper chest, right? Right? So that's exactly what happens when we are in pain, or when there's a chronic painful stimuli that just doesn't go for some reason. The whole breathing changes. Now, physiologically, that means your diaphragm is not working at an optimal capacity. Your ribs are not moving. Your diaphragm is not working at an optimal capacity. And what happens is that directly reflects into the way your pelvic floor muscles behave, right? So, to make the long story short, basically, if your diaphragm is not moving okay, your pelvic floor is not going to move okay. And that kind of gets into like this vicious cycle where you don't know what to do, the pain just doesn't go away, right? So that's where pranayama comes in. With pranayama, you're actually able to regain the movement of the diaphragm optimally and automatically, even before the pelvic floor knows. It's an automatic response. Once the diaphragm starts moving, the pelvic floor starts moving. A lot of times, pain could be because of the relentless lactic acid that's getting accumulated in the muscles, causing trigger point. Just pure movement, the ability of the muscle to let go, flushes out the lactic acid. So, there are studies that have shown that pranayama affects the pain response of the body, but this is how physiologically, like with the pelvic floor, it's directly associated. Like once the diaphragm starts working, your pelvic floor is going to start relaxing. That's how it's going to start working together.
You explained that so beautifully. Thank you so much. That was really, really nice. Breathing is such a big piece of the pelvic pain course that I just released that's for men. And it's a huge piece. And the way you explain that just there about how when you get that breathing going, it just naturally gets the pelvic floor moving again is beautiful. I've always loved the saying that motion is lotion. And so, you got to get things moving, just somehow, just get it moving. And that is going to be the lubricating lotion that kind of makes the pain go away. So you just summed that up perfectly. So, I mean, how do you incorporate breathing exercises into rehab protocols with your patients? quickly, I'd also say, how can people do this also at home? Because I know,
Yeah.
particularly right now in this time in history, a lot of people can't even make it into their PT.
Right, right. So before I go into how to do pranayama, I just wanted to give you two quick tidbits about research as to what research is saying about pranayama.
Perfect.
Okay, so I did refer to the International Journal of Yoga, and there have been recent studies as recent as 2018 that were done, which show that the autonomic system can be modulated. In other words, the sympathetic and parasympathetic response can be modulated with pranayama. And they did measure decrease in heart rate, decrease in blood pressure, and increased parasympathetic response. So that means calming measure. So, there's strong clinical evidence. So what we are going to learn now has a strong evidence-based backing. So I'm glad.
Yes, perfect.
Okay, so let's learn about how we could do these exercises at home. Okay, so as we were talking about, we are going to modulate our breathing. Okay, so a lot of people, a lot of times, are not used to doing these, right? So you're not going to go into the core of it directly before just observing your breath first. Okay, so the first step would be to sit on something that is not painful. So you should not be in pain when you begin with doing pranayama, right? So for people with any kind of back pain, pelvic pain, where you have pain with sitting, find like a comfortable cushion like I'm sitting on, or, something that gives you more comfort. Sometimes sitting on a cushy chair could also do, or anything that could take you out of that painful zone of sitting. Okay, so that's the number one step. The second step is your spine should be as erect as possible, because as we are trying to breathe in and out, we want the diaphragm to be at an optimal mechanical position, optimal position of advantage, where it could really work at its best capacity. Okay, so if I sit like this and try to do pranayama, my body will not be able to, my diaphragm cannot move even if it wants to, right? So it's very important that you sit with your spine straight. Sometimes what helps is, I'm going to move this back so that everyone could see this. Okay, so you sit on something higher and you let your folded feet come down. So that automatically corrects my spine. I don't have to try to keep my spine straight, right? So that is going to be my basic position. For people who cannot get their feet low, they could have support, like, a load here or something that could, keep you more comfortable. But the point is that your spine should be straight. That's how pranayama is going to work. Okay. Now, the first exercise that I recommend is taking something like a belt that would give you a reinforcement, and just take it towards your lower ribs. So this is like a pre-pranayama exercise that all of us should do, especially if you're not used to doing any pranic modulation of your breath. Okay, so you're going to take this around the lower border of your rib cage, right? Hold it snug with both your hands. So you should not kill yourself holding it very tight, but it should be snug enough. And then you're going to close your eyes and see if you could actually breathe into the belt, right? That way you will be more aware of the movement of your ribs, and that is critical when you do pranayama. Okay, so give it a little pressure. I'm going to demonstrate 2 rounds of breath. So you see how the belt is moving. I don't know whether you're able to see this, but the belt should be moving out and in. That means your ribs are moving, right? So if you feel like your ribs are not moving at all, then there are other things that you could do, like lying down on your side. Should I demonstrate that as well?
Go ahead.
Yeah.
This is wonderful. Okay. And I'm doing it now.
You.
I'm practicing just because I don't have a belt, but you could kind of get a similar effect by just holding on. But I think that belt would be a really nice addition.
Right, reinforcement. Yeah, so you lie down with like a pillow or a cushion underneath. So basically be comfortable, right, when you're lying down. And what you're going to do is put one hand on the lower rib cage, right, on your side, and just breathe into this hand. So you're going to inhale and exhale. One more inhale. And exhale. So basically, that hand is going to give you like what we call a proprioceptive feedback where the body knows to push against the hand, and that's how the rib cage opens. That's the easiest way to actually do it. So so I'm going to assume that we all have done this, and we have practiced this precursor, and then I'm going to tell you the next step. Okay, so yes, we are all good in rib mobility, and we are ready to do the pranayama. Okay, so you have to remember that in pranayama, when you breathe in through your left nostril, you are trying to stimulate the parasympathetic system. When you breathe in through your right nostril, you're trying to stimulate the sympathetic system. That means your body is going to try and get going, try and get excited about moving or doing something. Parasympathetic system stimulation is going to cause your body to calm down, right? So I'm going to show you two different types of pranayamas that everyone could do, and they're very safe even with pain people, right? So the first is called as the Anulom Vilom. Okay, so that means this is the pranayama in which you are going to actually balance out the sympathetic and parasympathetic system. So we are going to start by breathing in through the left and breathing out through the right. Okay, you will observe when you're trying to do this that one side of your nose is always blocked, right? So ideally, if you're healthy and there's no problem, no issues with your system, you should observe that in the morning time, your right nostril should be working better than your left. And at night, your left nostril should be better than your right. I mean, the air flow, right? That's in normal situation. However, sometimes, you feel sluggish or there's something very subtle going on, you're fighting a virus nowadays, like, you're fighting a virus or you're fighting something and your body is not the way it should be. In that case, you would observe that when you wake up in the morning, your left nostril is still going dominant and your right nostril is dormant. So there's a technique by which you could actually modulate your right and left. So which one is
my left nostril is definitely stuffy right now. Like it feels kind of plugged up, my left side. So
yeah.
What does that mean?
Let me see. So at your place, what time is it now?
For me, it's 4:30 p.m.
Yeah, so you basically are still working. You're focusing mentally on what I'm saying, right? So your right side of the brain is more stimulated right now. You're more productive. But before you go to bed, ideally, your left nostril should be working. So there's a simple technique that actually helps you modulate that. So that's pretty interesting. So when you're trying to start the Anulom Vilom Pranayam, you're going to try and press on the right armpit, okay? Right armpit inside, right? And you're going to just take in some deep breaths. So when you do this a few times, what happens is, this could take like a couple minutes. So, but what happens is when you press on your right armpit, your left nostril gets more free.
It is.
Right?
It is. Breathing out, it felt a lot clearer. It was just like there was no stuffiness. Yeah.
That's the trick. So when you press on the right armpit, your left nostril is going to activate, and when you press on the left armpit, your right nostril is going to activate. So when you do Anulom Vilom, you're trying to balance out both your right and your left nostrils, right? So you have to do 2 minutes of breathing with your hand here and 2 minutes of breathing with your hand here. Again, I tried to find evidence for this technique. There is none. So basically, this is wisdom that's been passed down through generations, but it works. So do this 2 minutes, and then we are going to start with Anulom Vilom, right? So finally, what you're going to do is you're going to close off your right nostril first. So the rule is to breathe in through your left, breathe out through your right. Okay, so you're going to close off your right nostril, breathe in through your left, take in as deep a breath, then close off your left nostril, breathe out through your right. Again, now keep the right nostril open. You're going to breathe in through your right, close the right nostril, breathe out through your left. Okay, so it gets a little confusing for some people who have no background about pranayama. You might have to rewind and view this part of the instruction. But once you get this, you'll observe that you're slowly starting to balance out the breathing. So let me cue you once more through the instructions, just so that it gets super clear. Because when I tell this to my patients who have no background in pranayama, they're like, breathe in through left and then breathe what? So let me give you an instruction once more. Okay, so it's super simple. You have two nostrils. You're going to close out the right? Use your thumb and your middle finger. So we use the thumb and the middle finger. In the beginning, don't make it that more difficult. Just use whatever fingers you want if you have no idea. But block your right nostril, breathe in through your left. So take in as deep a breath, right? And then you're going to close both nostrils. Now open the right nostril, breathe out. And now don't close off the right nostril yet. You're going to take in a deep breath through the right nostril. Close the right nostril and breathe out. Okay, so this is basically the technique of Anulom Vilom. You have to observe, though, that your exhalation and your inhalation in the beginning, exhalation and inhalation should be equal in amount. And then slowly as you progress, your exhale has to be longer than your inhale. Okay, so you're trying to get your body to breathe less number of times, and that way you're trying to calm down the nervous system. So that's one technique. Okay, for your pain patients, women who have pelvic pain, you could actually do the same technique in lying down position with a load under your legs. So let me just demonstrate so that it gets super clear. So you're going to keep something under your feet so that you feel kind of calm in your spine, and then you could either keep your legs crisscrossed, or you could just let your legs rest like that, right? So you're going to keep this is my comfort zone. So I'm going to lay down like that. That way your pelvis is a little bit elevated. Sometimes elevating your pelvis on the load also helps, because that helps decongestion of the area. You know how we do inverted postures? This is a similar concept. You're trying to raise the pelvis above the ground, so that you're trying to get the decongestion basically going on. And then you could do Anulom Vilom in this position. Or if this is too much, then you could just lie down with your legs like that and do the same technique. So you'll inhale through your left, close out both nostrils, exhale through the right, inhale through the right, close out both nostrils, exhale through the left. So this could be used for your pelvic pain patients, who are struggling with pain, not just pelvic pain, any kind of pain. Pain is basically a sign that your body is in sympathetic overdrive. Mm-hmm. So that's one technique.
I love it. That was really well demonstrated. And it's such a balancing breathing pattern. I think anybody could do that every day and just start their day off on a really, really good note.
Yes. No doubt about it. You can, you yourself will be able to, whoever will try this will be able to know that in a few days, the same kind of situation doesn't let your heart rate raise so much. Yeah. I'm standing here waiting for the subway. Subway is not here. My heart is racing. I'm going to be late. Doesn't affect you much, because now your sympathetic and parasympathetic systems are well balanced. Yeah. So, and also it keeps disease away, by the way.
Oh, yeah. Great for your immune system. Yeah. Yeah,
it's extremely good for the immune system. You don't get sick as much. You don't get flared as much. As simple things that I have observed in my case, I'm a little intolerant to gluten. When I'm very consistent with doing this, I can eat gluten and I don't have any flare up.
Wow. Mm-hmm.
Because then the system is calmed down, so the system can do its work.
Yes. That is amazing. I love that. Okay, good. So then what's the next technique? I'm excited for this.
Okay. So the next technique is called as Bhramari. Okay, so Bhramari in Sanskrit means the humming noise that's produced by a honeybee, like like a yellow jacket, what we call here in the United States, right? So it's basically transmitting your own voice signal through the bony contours of your skull, which produces like a vibration kind of a sound effect, and that kind of calms down the brain activity. So I was looking at some research yesterday because I really wanted to give you the most updated, latest, cutting edge what's there. What they have found out is with Bhramari Pranayama, the the theta wave brain activity of your brain is decreased. That means your brain basically goes into a relaxed state, right? So Bhramari it's very easy. What you have to learn is Ujjayi breathing. That means you're going to try and make a sound like you're snoring. So your vocal cords have to be partially closed. Okay, in the beginning it may feel a little weird, but try it when no one is around you. In the beginning, if you're a little embarrassed, the vocal cords have to be partially shut, and you have to breathe in through those partially shut vocal cords. So let me demonstrate. I don't know how well it comes through with the voice, but I'm going to try my best.
Yeah.
Okay, so vocal cords are now partially shut. It's more of a breathing that you could hear on a person who needs CPAP.
It's back there, and I've described it in the past and heard it described as like you're going like to clean your sunglasses and you go but then you keep your mouth closed. It's sort of a
yes.
Really describe, or yes. Like Darth Vader breathing. That's the other way they describe it, is like the sound of Darth Vader breathing from Star Wars.
Yes. Yeah, Darth Vader. Yes. So that's the way we are going to use the breath, right? So it's not going to be a clean breath. It's going to be a more of a Ujjayi breath. That means Darth Vader breathing, right? And what we have to do is we have to shut our ears closed. Okay, so don't do it before I finish the instructions. Otherwise you won't know. So shut your ears closed, and the pinky finger should close your nostrils. So basically you're closing out all the openings of your face, right? So you're closing out your ears, you're closing out your nose. The middle finger, the ring finger stays on the inside of your eyes, and the two fingers on the pineal gland. So it's a little, so I'll show, yeah, so it's like this. Yes. And all you're going to do, it's like wearing glasses, right? And all you're going to do is shut the openings closed, and you're going to try and take in a deep breath, Ujjayi, and then hum, like that.
Okay, I'm doing it. Wow, it's weird.
Yeah, it is weird, but you would notice that your skull literally vibrates when you do this. Like you could feel the sensation going around the bony contours, and that has actually shown to decrease the theta wave activity in the brain. So
to be clear, you pinch off the ear thing.
Yeah,
on
pinch it off.
The little area.
Yeah, so you basically, you should not hear anything when you're doing this, right? It should be like, you're completely drawn in. So no external stimuli. Your ears are closed, your eyes are closed, your nose is closed, and you're going to take in a deep breath before you close your nose, right?
That's where I got tripped up. So I actually closed my nose first, and I then tried to take a deep breath, and then okay.
No.
Yeah.
So take in a deep breath even before anything happens with the closure, right? Take in a deep breath, Ujjayi. Then close it off, and then hum. So let's try. Yeah, but in the beginning it may be claustrophobic a little bit, but with practice it's a very effective technique.
Yeah, crazy. Okay, that's really cool. Okay. Yeah.
Yeah, and this actually is excellent for calming down everything that's in the overdrive. So that's good.
I love that. And everyone can use that right now. Like this day, everyone can use that.
And the principles of sound are that, like, have you ever tried like a hammer? You bang a hammer, like the one that we check our reflexes with. You see how the hammer vibrates, right? The same thing goes on when you hit your skull or any bone with sound. Sound is very powerful. They have those sound therapy bars nowadays, right? Sound therapy chambers where they buzz on different gongs and you are exposed to the sound. So over here, you make use of your own sound wavelengths to calm your system down.
I
So it's
love
very, very powerful.
I love that these techniques are free as well. Like we can do them
Yeah,
at home. They're completely free. I mean, sound baths are amazing. I've been to some sound healing things and they're worth every penny. But sometimes when you don't have access or the finances to go to something like that, you can just do this at home, your own sound healing. That's amazing.
right. So that's another very, very powerful technique, actually.
I
So
love it.
I think,
Yeah. Was there anything else you wanted to share? Because I know that our time is limited together.
right. So, you know what I would encourage people to do is even before pranayama, like go back and review your diaphragmatic breathing techniques. Like, even before you venture into pranayama, because pranayama is literally, it's like, third grade level work. You have to start with the first grade, right? So, and I mean, there are so many more advanced pranayama techniques, but due to the limitation of time, and it really takes some practice before you actually could go to that level. But these two are the safest and the easiest to practice. And right now, in this current like world situation, we really want our system to calm down. So these two pranayamas will help you calm your system down. And again, as you said, it's free. So all you need is some discipline and a place where no one is going to bother you for 10 minutes, and you could do it totally. And there's no limitation about when you could do it. You could do it anytime. Ideally, you should do it early in the morning or right before you go to bed. Try not to do it with a full stomach, like, don't do it after like a full tummy or after meal, because, that's going to affect the diaphragmatic descent. But otherwise, like, when you're relatively empty stomach, you could do it.
Wow. This has been amazing. I am so excited to share this with my community, and I want to thank you so much for being here and sharing this with us. And how can people get in touch with you if they want to learn more about you and your work?
Sure. So my Instagram handle is @dr, my first name and last name, Amruta Inamdar. So it's a little complicated. I think Bree will help us out with that, right?
Yes.
And the Facebook page is the same. My first name, last name, Amruta Inamdar, and last name, and pelvic health physical therapist. So you could follow me on Instagram and Facebook. If anyone would like a PDF copy of what we have learned today, I would be happy to share that, because I really, really believe in spreading the message, and I want to follow Bree's footsteps. She is spreading such amazing knowledge, and everything is for free. It's like the more you give, the more you receive. That's the law of the universe. So, if anyone is interested in knowing more, I would be happy to help. That way.
Wonderful. Thank you so much. And yes, all of the information will be in the show notes and video notes, whatever we want to call that. So definitely check that out. Thank you so much for being here, and I'll be talking to you again soon.
Thank you so much, Bree, for giving me a chance to be on your show with such a big following. I'm telling you, this is a dream come true for me. So thank you for believing in me and giving me a chance to talk to your community.
It's my pleasure. Bye.
Thanks. Bye.